You want me to look here when you're talking to me, or you want me to look at you?
Uh, you could do a little both, because that's what I'm
Okay.
gonna be doing.
Okay.
Okay. All right, my it's on. Your green. Green. Yeah, I see your green.
Okay.
Yep. Okay. 3, 2, 1. Hello, hello, and welcome to the Black Wellness Exchange podcast. I'm your host, Simone, and today I have the absolute pleasure of being with Dr. Tasha. Oh my gosh, from Abundance. Say it right. Let me say
Abundance Healthcare.
There you go. Abundance Healthcare Family Clinic. I am so excited to have you. Thank you so much for being here today.
Of course.
We kind of want to make sure that we highlight and make sure the people in our community know that you are here, right?
Yes,
So
I'm
tell
here.
us, where are you? How can we find you? Where are you?
So I'm located on the southeast part of Colorado,
Okay.
3225 International Circle, Suite 220.
Mm-hmm.
And that's across from, I guess they call it the Memorial Park area.
Okay.
Yep,
Okay.
southeast part of Colorado Springs.
Oh, okay. So that's like where they play all of the soccer and
Yes.
all of that right in that area.
Right in that area.
Okay, I know where that is. Okay, nice, nice. And who do you see? Like, do you see kids? You see
Yeah,
grown folk?
so
What you see?
everyone, if you're 6 years old or older, so if you're 6 or older, you can come to my clinic.
Okay,
Yes.
okay, 6 and older. Ooh, so you deal with the little book snot children. Okay,
The
okay.
little precious children.
Okay, if you want to say precious, you want to say precious.
Yeah.
Understood. So you give shots. What all do you do? Like,
So basically, from primary care, prevention, chronic care management, and then we also do a program called remote patient monitoring, where for some of my patients with chronic diseases such as hypertension or diabetes, I give them a monitor from the clinic where we monitor them more closely. All their readings that they take come into their chart directly. And then if they have abnormal readings, me or someone from my staff will call them and find out, hey, what's going on? Why is your blood pressure 180 over 100? Are you taking your medication? Are you having any symptoms? And so that gives us more touch points, as we call it, with our patients. So if you have that monitor, we're reaching out to you at least once a week or more often, depending on your readings.
wow. Okay. So you ain't even got to touch me, doc. You could just get the little monitor, and we could be connected.
Yes.
Wow. But that sounds like you said that's for chronic care management, for high blood pressure and other things.
Yes, high blood pressure, diabetes, if you have COPD, some people with asthma. If we're doing weight management, we can give you a scale and you check your weight, and it comes directly into your chart at the clinic.
Wow, so that's like full service. You see everybody for everything, for every reason. That's what I'm talking about. Yes. Full body care from head to toe. I mean, what about your eyes and your teeth and all that stuff?
So we refer out.
Okay,
so we'll send you to an eye doctor.
Okay.
That's a specialist. Or for your teeth, you go to the dentist.
Yeah.
I do women's health, so gynecological care.
Okay.
If there's something abnormal that comes back with your pap, where you need a copo or a biopsy or something, then we send you into maybe a women's health clinic.
Okay. Okay. So everything though, outside of the specifics, eyes, teeth. Got you. Okay. That's awesome to know. So I'm just gonna ask you a few questions.
All right.
I mean, you ready? I just want to make sure you're ready. Okay. So let's see. What inspired you to start your practice? Like, what inspired you to start Abundance Healthcare, and what does abundance mean in the context of wellness and primary care?
Okay. So I decided to open my own practice, I think probably when I was like year 3 into practicing.
Okay.
I love caring for the population that I was caring for. What I did not love was those 15-minute visits and seeing 26 patients a day. I think that was a little bit too much.
15 minutes?
Yeah,
26?
15-minute appointments. Sometimes we got maybe 30 minutes if it was a newborn or a hospital follow-up. And so what inspired me the most was to be able to sit down like I'm sitting down with you, to talk to my patients, to have a conversation, and to let them know we're on the same level, just like We're in the same level right
Yes.
here. So what does abundance mean to me? I take it back to the Bible where God says he wants us to have life and have life more abundantly. And how do we do that? That's by having relationships. So before, my practice was more transactional because I had that 15 minutes to do a transaction. Now I want to build that relationship with you at abundance. And so I
Yes.
don't want to just serve you. I want to serve those members in your household because your health affects those other people in your household. So if I can impact that whole household, then I can therefore impact that community. And that's what I want to
Indeed.
do. And so that's why abundance is here, and that's how abundance forms.
Okay, she said from the Bible. I
Yes.
love that. I love that. Like, it is understood that our wellness is resistance, right? Us being well allows us to resist the other areas,
Yes.
other things in our lives that may be causing a little bit or a lot of stress or grief, mentally, emotionally, how things affect us. When we are well, we're able to bounce back and be
Yes.
resilient to combat those things. And the fact that you assist the community in doing that is awesome. Give me a high five. Give me a high five. I love that. I love that.
Yeah.
So, as a family nurse practitioner, how do you blend your clinical expertise with culturally responsive care?
Well, first of all, it comes to me recognizing that the patient is the one who's in charge. So when you come into my clinic, one of the first things that I tell you is everyone's not for everybody. So if I cannot help you, then let me help you find someone who can help you. The second thing I say is, what are you willing to do? Because I can prescribe you a medication, but if you're going to take that medication, it's going to sit on your counter at home, then there's no need for me to prescribe in it. So how I blend in is listening to you. You tell me what you need to better your care. I'll tell you what my knowledge is. I can give you this pill, for example, or I can give you that pill, or we can work on diet. I have a nutritionist who's in clinic on Tuesdays.
Okay.
Because what we eat impacts our health. I know a lot of people don't believe that, but it's true. What we put in our body affects our body.
Yes.
And so I have a nutritionist that sits down with you, look at what you're eating, and develop a plan specifically for you. So it's not just a one size fit all. And so I work with what you're willing to do.
I love that. So let's take me for instance,
Yes.
I come into your practice, I got a little high blood pressure, or I have some thyroid stuff going on. You're saying that based on what I'm willing to work on, what I'm willing to share that I have and work on, you would not only you, but possibly incorporate your practice nutritionist to kind of help create a treatment plan to make sure that I stay on top of my high blood pressure and thyroid. That what you said? That what you said?
That's exactly what I'm saying. And if you're willing to, because change is hard. So if I'm used to eating fried foods all the time and those good old Colorado collard greens and the macaroni and cheese, and sometimes my sweets and everything, and then somebody's telling me, hey, you need to change this up a little bit, that's hard. So like I said, once again, it's based on what you're willing to do. We develop that relationship, that trust. And based on that, I know what we can begin to do, or what you're willing to start to do as far as your health is concerned.
Well, I ain't gonna tell you I'm gluten free because I like to eat bread. But okay, wow. So the fact that you guys will create a plan to make sure that what I'm willing to work on is something that we actually work on. Yes. I love that. I love that. Okay, all right. So, what are like common issues you see in community, like, and how does your clinic address those gaps?
So some of the issues that I have seen, one I would say first of all is with transportation, getting to the appointment. A lot of my people have problems with that. So I have sought out transportation companies, called them, saying, how is your service, before I even refer my patient to that transportation service. Depending on what your appointment may be for, I also provide telehealth care. So you can be anywhere in the state of Colorado and I can see you. And it
hold on now.
Yes.
What you say? You offer what?
Telehealth. Yeah. So just like you do a Zoom call, it's similar to like a Zoom call, but it's all HIPAA compliant based in my EHR. You get a link, and there I am on camera speaking to you. If I need blood work, I can send it to a Quest in your area. Yes, medications we can send anywhere to any pharmacy in Colorado. So I can see I am licensed in the state of Colorado, the ability to see patients in Colorado. I do like to have at least once a year a face to face so I can get to know you and everything. But some of my patients, I have patients who are in Denver. I have patients who are in Castle Rock. I have seen a couple of patients from Trinidad. And so I can, not Tobago.
I was about to say, wait.
But there's Trinidad, Colorado. But yes, so I can see you in the state of Colorado and send lab orders, medications. I have worked with another company that does like mobile EKGs in the state of Colorado, mobile ultrasounds. So I'm trying to make sure you get the service that you need where you're at as well.
Did you hear that? So wait, you said that not only do they can come in the office.
Correct. Mm-hmm.
You can see them on the computer too?
Yep, telehealth. Yep, we do telehealth.
Do you go to the house?
Yes, depending on your insurance. So some insurance plans will cover in-home visits, some won't. And the thing I think a lot of people need to find out or know about insurance, let's say you have XYZ insurance. XYZ insurance may have 150 different insurance plans underneath that.
Right.
So even though I'm credentialed with XYZ, I may be credentialed with XYZ number 1 through 50,
right,
and then number 90 through 100. So in maybe 90 through 100 says you can do in homes, but 1 through 15 says you can't. Right. So it depends on your plan. But yes, I do go to the homes as well.
So we talking about removing all the barriers. Transportation, yes, transportation, telehealth. That's like if someone has trouble, I'm just gonna say ambulatory wise, walking, maybe telehealth may be more easier for them. And then you said based on the insurance, you go to the crib. Yes. Excuse me. She goes to the house. She goes to the house. What? Yes. That's amazing. I love that. Sounds like you also there's a bit of case management, I heard, where you kind of coordinate, the transportation part. You kind of check it out. Like say that part again.
So I don't believe in referring patients or also prescribing stuff that I wouldn't do for myself.
Okay.
And so I have a nice receptionist who happens to be my son, and then 2 other health associates that works there. And so yes, we're trying to provide services as far as transportation. A lot of people that I serve that's Medicaid population don't realize that they have a Medicaid case manager as well.
Yeah.
And so I hook them up and say, hey, did you know you had this? And they're like, no, I don't. I send stuff through their patient portal because they also get incentives to come for their actual wellness visits and to get vaccines and stuff like that. But a lot of people don't know about it. So I send them that. It's like Medicaid will do this, that, and other for you. So anything that can help them, I try to give those services or provide the information where they can gather those services.
I love that. So a little bit about me. I don't know if I've ever shared this. As a social worker, I used to work for Medicaid.
Oh, wow.
So yes, I used to do So my role was a care coordinator.
Yes,
so for individuals, so for individuals that were needing either had complex care or just needing additional support, they could pick up the phone and say, I need care coordination, and we would coordinate, assist call the doctor's offices and make appointments,
but they don't know that.
No, they don't. But the fact that your office assists your Medicaid patients in finding and utilizing that service is awesome, because you're right, everyone does not know that is available, even in some I guess, how would you say, corporate insurances, or some of those services are still available.
Yes.
So that's awesome that your office helps your patients kind of link to those services. That's also those resources. So let's see. Let's talk about medical mistrust. Child, you know folks don't be wanting to go to the doctor in our community as it is.
Yes,
Last time Unc went to the doctor, they done told him, and Auntie went to the doctor, they done told him they had this, and this. But people fail to realize that if Unc and them don't go to the doctor,
that's right,
they don't know what they have or don't have. So yes, when they go to the doctor after 30 years of complaining about this pain, they may have a longer list than someone that takes, that is kind of on top of it. Right. So in reference to those mistrusts, how do you empower your patients to take control of their own health, understanding that those mistrusts are out there?
So I think one of the ways is I share my experience with the patients. Full disclosure, I have hypertension and high blood pressure. And so I know stuff. I'm in the medical profession, so I'm not going to take a medication. You know why I'm not going to take a medication? Because hypertension is from stress. That's what I'm telling myself. So I quit my job.
Okay.
So you can't have stress if you quit your job, right?
Well, you right. That's a large source.
My blood pressure was still high.
Okay.
So I go to the gym twice a day, not twice a week, twice
a day.
Blood pressure is still high. Yep. I ain't listening to that doctor because I know. So what I do, I change my diet. Yeah, I just eat salads. Yeah, I'm good.
Okay.
Still got hypertension.
Still got high blood pressure.
So I said, hey, stroke, heart attack, which one? Because I'm having headaches every day and all that. And, we say in the medical profession, it's so true. History is king. Both of my parents have high blood pressure.
Okay.
Their parents, high blood pressure.
Okay.
So I decided, yes, I'm going to take this pill.
Okay.
I'm going to trust the process, take the pill. And so I share that experience with my patients to say there's things that we can do, that we can change, that will help us. But sometimes those genetics are hard to beat. Now, with all those changes, I have lowered the medication that I'm on, and I'm doing better. And maybe eventually I may be able to stop it. But the mistrust, I grew up seeing that mistrust. I grew up having problems when I was a child with lactose. I didn't know it was lactose intolerance, and neither did my mom. But I heard how the providers talked to my mother. I was considered crazy because there was nothing wrong. Why is she having all these cramps? Why is she waking up in the middle of the night? Some doctor listened and finally tested me. And that's how we found out. But besides that, how do I empower my patients? Is to ask questions. Don't just a provider say you have this, just take it. And my patients have that ability to ask me questions, and I explain, I educate. Education is powerful. And so I educate my patients and we make those decisions together. Once again, as I started out today, I told you, you are in control of you. You have to live with you. I don't have to live with you. You have to live with you. So you have to do what you're comfortable with doing.
Yes, comfortable with doing. Yes. I went to the doctor one time. God dang, I'm about to get on my soapbox. I went to the doctor one time and I said, Doc, ever since I started taking this my thyroid medicine, it just seems like my stomach gets uncomfortable. Like I get this uncomfortable feeling in my stomach when I eat bread. And my doctor's like, are you sure? And I'm like, I'm pretty sure I know what my body feels like. So my doctor went through my chart. Well, you don't have celiac. Go ahead and keep eating it.
It should, but you have thyroid disorder.
Right.
Gluten's not our friend. I have it too. Gluten is not your friend when you have a thyroid.
That's what I'm talking about. That's what I'm saying. But my doctor was like, no, you don't have that diagnosis. I guess looking for a diagnosis. You don't have celiac.
But you have
keep
thyroid
eating
disorder.
It. Right. But my doctor knew that.
But we're not taught about nutrition as much as we are about other things. And that's why I bring that nutritionist in. And once again, nutrition is so important. I was not told when I was diagnosed with thyroid disorder that, hey, you may have issues with eating gluten. Gluten's not your friend. I wasn't told that either. I was told, here's your pill.
Right.
And I'll see you back in a year.
Right.
And that's it.
Ain't that something?
Yes. Mm-hmm.
But why would they do that to me? Take me off all the bread. I just Hawaiian sweet roll.
Well, you can eat it, but you're just going to pay for it.
I don't want to pay twice. I don't want to pay twice. They so good at this.
Yep, you're going to pay for it. You are going to pay for it with that thyroid issue. You're going to pay for it.
But the mistrust part is that my doctor dismissed the fact that I told him I was uncomfortable, that this bothers me, and knew that I had thyroid. But as you said, that nutrition fact, that nutrition piece, and I think culturally, considering culturally that that's also important. Another important reason to have a nutritionist included, as you said, in your care, because that helps us to understand what we need to do to get better if we're willing, what we don't need to continue to do. Because as you said, either what'd you say, stroke
or heart attack.
I don't know about you, but them ain't the options I want to have for my life. So as your practice is named Abundance Healthcare, I want to live abundantly and and stroke or high blood and heart attack ain't in it. No, but that's awesome. Now, in field, it also sounds like you create a safe space for your patients to feel seen and supported, because you offer the different services and advocacy methods, right? I mean, so again, you advocate for your clients as far as like kind of, getting rid of those barriers, making sure they have transportation. And if it's not transportation, we get you a telehealth link. That's right. It sounds like Medicaid clients that come in, that you offer them support or making sure that they understand what all benefits that they have that they can utilize through your office. And then you said that you see them little diggy nose children, and then you see. I'm sorry. I said precious. My bad. I said the diggy nose. She said precious. Whatever. Those precious children that you see all the way up to. It sounds like you said geriatrics. You have some elderly.
I say mature adults.
Excuse me. Yes, mature adults. Excuse me. Mature adults. It sounds like you support each one of them to the best of your ability, but it sounds like it's a lot. It sounds like it's a lot.
It is. I'm not going to kid you. It is a lot. That's one of the reasons why my practice is only open 3 days a week.
Okay.
And my employees know, I told them, I'm very honest with my employees and with my patients. If you want a full-time job, you came to the wrong place. I believe there should be work-life balance. I should not be at work more than I'm at home or with my family. And my patients know that as well. And they know when they can reach me, how they can reach me. And they know that when they have an appointment, that I'm going to do the best that I can for them. So I think that makes all the difference. And we like to have that personal relationship. So I'm not trying to have 1,200 patients like I had with the other practice that I was in. Right now, we're sitting at around 500 patients. Don't really want to grow more to 700, 800 max. If it gets more than that, then I'm looking at, let's bring on another provider to help. But there has to be that balance there.
Okay, so
I have to take care of myself too.
That's right.
In order to help take care of you.
Let's talk about this work-life balance. Can you write my job a note to tell them that I should not be at work more than I am with my family?
There you go.
Can I get an excuse so that my job can know this? What?
Your job know this, and I think when we look at other countries, how they don't have that 5-day work week, they have that 4-day work week. And so yes, I'm trying to find that balance, but also take care of the people that allow me to take care of them. I consider it an honor, and I consider it a privilege that people allow me to be a part of the healthcare.
Indeed. So it also sounds like you are a walking example of healthy boundaries also, because the importance of having healthy boundaries, not only with work, but for your personal self, is so
it's important.
Oh my gosh. Well, thanks, Doc. I so appreciate you coming through and talking to us today here at Black Wellness Exchange Podcast, where we are growing, but we also are growing with, growing a community. And it sounds like you are also cultivating an excellent, not only healthy community, abundant community, but it also sounds like educated community, because it sounds like you offer your client base a level of education that maybe some other practices may or may not, but you educate your clients in knowing what's best for you, what's not best. I don't know. I can't seem to get stroke or heart attack. That seems kind of harsh, Doc, but that's sometimes those realities. But you educate and also offer tools to support your patients in making sure that they can reach abundant healthcare. I love that. I love that. One last question for you, Doc, because I feel like I want to ogle today.
All right.
Grits.
Okay.
Well, maybe polenta for us gluten challenged people, but either whole wheat grits or corn grits. How do you eat them? You put sugar in it or salt and pepper?
No, she didn't give us the perfect option.
What's the perfect option?
Ketchup. Ketchup on grits with your fish. Ketchup. I've been eating ketchup on grits. Oh my gosh, maybe as long as I can remember, since I was a kid. Yeah, ketchup.
Ketchup. I'm finna
sugar-free ketchup now is what I have on them, but yes, ketchup on grits. Forget the salt, forget the pepper, forget the butter, and it's definitely not the sugar. Yes, ketchup.
What? Y'all hear that? She puts ketchup on her grits, but then she did say she had a little fish with it, and I can eat the little fish and grits. But
ketchup on grits.
I'm gonna have to try that one out, Doc. I don't know. But she said sugar-free ketchup too. I'm gonna have to see, Doc, but I don't know. But thanks again so much for coming and being with us today. Let us know again, how can we find you and where you at?
So it is Abundance Healthcare, southeast part of Colorado Springs, 3225 International Circle, Suite 220. Or you can go online, because it's yours, abundancehealthcare.org. And you can also, once you go to that website, request an appointment online as well.
Excellent. Thank you so much for being here. And thank you all for joining us here on Black Wellness Exchange. Please feel free to contact us and let us know if there's some topics or questions that you may want to ask her or maybe any of our other guests. But thanks again. You guys have a great day.
Bye.
Oh, how do I turn it off? Where's the clicker?